How does chronic urinary retention cause overflow incontinence? Imagine a bladder that's supposed to hold urine comfortably until you are ready to go, but instead it becomes a trap that fills up and can't empty properly. That's what happens with chronic urinary retention. When the bladder can't fully empty over a long period, urine keeps building up, stretching the bladder beyond its normal size. This overdistension increases the pressure inside the bladder. When this pressure gets high enough, it can push urine out involuntarily, even though the person might still feel like they need to urinate or cannot fully empty. This is what we call overflow incontinence. The main cause of this situation is a blockage at the bladder outlet. This could be due to an enlarged prostate in men, urethral strictures, bladder stones, or tumors blocking the flow of urine. Sometimes, the muscles that help the bladder contract, called detrusor muscles, don't work properly. This can happen because of nerve damage, certain medications, or neurological conditions. When these muscles don't contract strongly enough, the bladder doesn't empty fully, leading to urine retention. As urine continues to fill the bladder, it stretches more than it should. This stretching raises the pressure inside the bladder. When the pressure exceeds the strength of the urethral sphincter, the muscle that keeps urine from leaking out, urine begins to escape involuntarily. This leakage often happens gradually and continuously, or as dribbling, especially when the bladder is very full. People might also notice they feel the urge to urinate frequently but still can't fully empty their bladder. In some cases, nerve problems cause a lack of coordination between the bladder and the sphincter. This is called detrusor-sphincter dyssynergia. When the bladder contracts but the sphincter doesn't relax properly, it creates a functional blockage, worsening retention and leading to more overflow leakage. Chronic retention can also cause structural changes to the bladder. Over time, the bladder wall may become thickened and less flexible, which makes it even harder to empty. These changes can lead to a cycle where the bladder keeps overfilling and leaking. From a health perspective, untreated chronic urinary retention can lead to infections, damage to the bladder, and even kidney problems. If tumors or other growths are involved, they may cause or worsen the blockage, making prompt medical evaluation essential. Managing the underlying cause, whether through medication, procedures, or other treatments, helps restore normal bladder function and prevent complications. If you experience symptoms like difficulty emptying, frequent urination, or involuntary leakage, it's important to see a healthcare professional. They can assess your condition and recommend the best course of action to protect your bladder health.